Government believes the continent's most industrialized country may escape a more severe fourth wave of COVID-19. It attributes this to stricter measures implemented to stop the spread of this pandemic. Millions have now been vaccinated, but there are still many more yet to get their dose of available vaccines. But what if the fourth wave struck now as the country battles to escape economic stagnation? Joining us now to discuss the impact of COVID-19's fourth wave on the economy is B4SA Steering Committee chairperson Martin Kingston. Mr. Kingston, a pleasure to have you on the program this afternoon. Now, with prospects of stricter lockdown regulations sound almost unthinkable for businesses who are still feeling the effects of COVID-19 and the stricter regulations that accompany this pandemic. What do you make of the possibility of a fourth wave of COVID-19 infections?
Well, good afternoon, Shankar, to you and your viewers. We are very concerned, as you said, about the possibility of the fourth wave. Most people are predicting that it could take place any time from the end of November, beginning of December, for the next couple of months, with very dramatic ramifications, obviously, on health, livelihoods, and the economy at large, exactly as you have said.
So with COVID-19 infection figures being relatively low, what's worrying is that the vaccination rates have also somewhat dropped. What has been your assessment in this regard?
Yeah, so we are vaccinating at a much lower level than we have the capacity so to do, both in the public and the private sector. We have all the vaccines that we require, both Pfizer and indeed J&J. We've just started this Sonka 2 program for the healthcare workers. We've got plenty of sites around the country. In fact, we've got too many sites for the number of people, as you say, who are seeking to be vaccinated. We've got the Vuma weekend this weekend. We saw numbers yesterday about 145,000.
Yeah.
That's a good number for Saturday. But that's the number that we've been doing on a daily basis, when we should actually be doing about 350,000 a day. We've got the capacity to do that. So we need to drive the levels of vaccination up very aggressively, particularly, but not only for those who are above 60 or indeed above 50, basically the population at large, if we're going to get to the sort of levels of vaccination that we need to do, not only by the fourth wave, but over the festive season, as you've said, but we want the economy to be as open as possible, let alone into next year.
Let's expand on that sentiment that you make in your last point. I want us to speak about this need to open up the economy as quickly as possible and also the need to encourage tourism. Talk us through this aspect.
Well, we're at adjusted level 1. All of us will remember what it was like when we were at levels 2, 3, let alone hard lockdown at level 5. As a country, we cannot afford to be there. Of course, we all know the reason for that is to stop the pressure on the healthcare system, and that's exactly what happens during fourth waves. That's what we saw in the third wave. In Europe, they are already now experiencing a very dramatic fourth wave. We need to keep away from that, but as you said, a significant contributor to the economy at this stage is in fact not just the tourism, but tourism, leisure and hospitality sector, which has been devastated over the past 18 months and needs to be as open as possible. So we need to balance those two imperatives. We need to encourage tourism, particularly from abroad. It generates both sustainable employment as well as foreign exchange for the country as a whole, both absolutely critical. But we can only do so if we're going to both vaccinate on the one hand and ensure that we continue to maintain observing the protocols of of mask wearing and social distancing and, of course, sanitization. And we've seen a drop-off in that as well. So the risk is that at the same time that we try to maintain keeping the economy open, particularly for tourism, we actually exacerbate the risk of transmission at the same time. We cannot possibly afford that as a country right now. We know that last year we saw a huge contraction in the economy in terms of GDP. Nearly 2 million people at one stage had lost their jobs. We've recovered some of that, but woefully inadequate. We now need to boost those activities, specifically around the leisure, tourism, and hospitality sector.
Right. So as we wrap up, and we've heard a few of the suggestions that you make, in your view, what would it take to avoid a situation where stricter lockdown regulations may be imposed as a result of this possible spike in infections?
Well, we're looking at the possibility at the moment of introducing vaccination passports or vaccination digitization certificates, so that people are only given access to events, whether it be sports events, cultural events, on demonstrating that. We think that will boost vaccination. Companies instituting mandates so that their employees need to be vaccinated to go to work. We think that will also encourage it. Those two measures alone, we think, will have a very significant effect on increasing the level of vaccination ahead of the fourth wave and indeed ahead of the festive season. But as I said, at the same time, we need to maintain all of those protocols we've become so used to over the past 18 months. The two of those, we believe, will have a very significant impact on being able to either not avert but delay and then reduce the impact of such a wave.
Mark Kingston there giving us a view from business regarding these prospects of a fourth wave of infections, saying that vaccination also needs to be ramped up.